Hello and welcome. This is the first session of Project Enlist Canada Virtual Chats. I want to thank Galvian, our sponsor, who's the founding sponsor of Project Enlist Canada, for making this possible. We often hear from CAF members and veterans, I've never had any brain injuries during my service. Does any of this really apply to me? I'd like to hear first of all from you, Lieutenant Colonel Kernaghan. Do you think there are lots of veterans out there that have been able to make it through both their training and service with no brain injury?
I would say that there are very few who have. The things that we're exposed to is there's so many ways to get a brain injury. I mean, I said it during my introduction about the number of things that potentially I have going on. I don't want to suggest that everyone has that going on. But there's so many sources of brain injury, and I guess first of all, that's the first thing, is there's so many sources of it. The second thing is that people saying that they don't have a brain injury. How do you know? It's the brain is what's telling you whether or not you have injuries, and it's the very thing that's injured in this case. So for myself, I dealt with this is an exaggeration, over 100 different people that I worked with over the years, and subordinates who had brain injuries of different types, and always tried to be there for them. But I thought that I recognized all the signs and symptoms, and I certainly knew all the resources that were available to send them to. But when it came to me, someone else had to tell me. Someone else had to say to me, "Do you think you should get checked?" Either denial or just my brain not being able to tell myself, recognizing myself that I was injured. So yeah, I guess that's the bottom line, is there are so many ways of getting injured, and how do you know you're not?
Thanks. Alannah, what was your experience with head injuries during your service?
I'm not like the easiest on myself that a lot of people might take care and stuff. So I found that, we just, as medics, we have extra kit. So when we are deployed with, other units, we're just as active as they are. Plus we have this additional kit that we have to worry about as well. So then you've got the helmet and you've got the rifle, and now you're dealing with the patient. So, I mean, there's been times where we would do training and, mishaps happen, or you knock yourself, or you fall down an embankment. Like, these things happen. I mean, as a medic, we've seen lots of head injuries. It could be, being stopped really quickly in an APC because you hit a wall, like a mud wall. And now you have the shearing force of, that impact. And then you have the brain impact. And then in Afghanistan, like I mentioned before, you have the blast waves, and you have just the impact from being inside the vehicle when it's firing those rounds downrange, like, or being in the vehicle next to it. You can still feel, what that feels like just from having that, or the explosions for that matter. So, I think about just the tour that I was on Aunt Medusa in 2006, 2007. And I think about, like what we were exposed to with the mortaring, the RPGs, being in the firefights, quick stops, quick goes, going off of a road, like all these things we were involved in. And for me, I knew I was pretty messed up when I came back. And I didn't quite know why, because you're trying, like, this information wasn't really out there. We didn't talk a lot about head injuries. And I knew I was having issues with concentration. I was having anger issues. The biggest thing that sold it for me was when my reaction to something fairly minor became a big, huge, dramatic response. And then I was like, well, that's unreasonable. That's not a normal response to a minor incident. And I was like, I'm not well. I'm not doing well. I think at the time I was just so focused on blaming other causes that it never occurred to me that it was inside my head. So I think that's just been like, so I was officially diagnosed in 2010, but in these past 11 years, I'm starting to question, do I have a TBI? Because there's such a close correlation between the two. But, you know, I've had, you know, up armored hatches fall on my head. I've had that compression. I was involved in firefights. I was there when explosions occurred. So I have to wonder, like, you know, how many of us are out there with a mental health diagnosis when in fact we actually have a physical and mental health diagnosis.
And really, really interesting to hear this from you as a medic, right? That's got a real focus on health and is you know, in some ways trained to be looking for injury. You know, what's your thought in terms of, you know, your regular everyday soldier? Do you think they have any sort of thought about this information, or do you think they have any consideration of the role of brain injury in their health?
No, not at all. Because like I said, even for me, you know, I had a background in, you know, I trained the soldiers combat first aid. I trained the tactical combat casualty care courses. Even myself as a medic, you know, what are we looking for? But, you know, even when you're teaching blast injuries, you know, we're taught to deal with the initial injury. We're not taught, you know, how to deal with these injuries as they show up 5-10 years later, or, you know, now they're more magnified, or now it's more obvious, or maybe we just have more information. So I would say, like, we're looking for the instant injury, but I don't think the information has been out there. Like, even just PTSD information, it hasn't been around very long. You know, I just remember even, I don't know, maybe 5 years ago, I think it was put in print that I had PTSD. And I was so uncomfortable with that. I was not yet ready to have that put out there. And I do realize that, I guess, the more people recognize you for doing your job, that it's important that people see that others have it. But I think it was the first time that I had actually admitted to the world that I, in fact, had PTSD. And it's not because I felt weak. It's just I still didn't fully understand it, and I still react, right? I still have the anxiety. I still have reactions to things that I wish I didn't react to. So I do think that the more information out there, the more, like, people need to know what to recognize. Like, we have to recognize it first, then we know what to do with it. And I think that's where we're at still. We're still at recognition.
Bruno, I saw you nodding. What does that reflect your experience? And, you know, Alannah talked about, you know, what you need to recognize. What did you recognize in yourself?
Well, yeah, just to, you know, to add on to Paul and Alannah, what they brought up is exactly what's going on. We got to remember the mentality of the soldier as well, right? The way that we, from basic training to when we join in to all of our training, you know, the words "suck it up," "soldier on," "keep going," all these things. A lot of people, a lot of soldiers think that a concussion is you pass out, you're unconscious, or, you know, there's an injury, a major injury that happens. But, you know, being a paratrooper or being a diver or being a mechanic, or like Alannah said, a hatch falling on your head or something like that, I know that I've got my bells rung many, many times, and you just keep on going because you don't want to let the team down. You don't want to get cut off course. You don't want to get, you know, so the mentality gets to go in there as well. And you got to understand, you know, how do we educate and how do we recognize these signs? And like Paul said, it needed somebody else to tell me. Alannah, same thing, somebody else to tell me, hey, something's going on, or that you get the awareness to say, hey, I should be okay with reacting to this situation and no problem. And these are the symptoms. But when you're always on top of the game and learn to grow and push your body and your mentality and your emotions to the top level for peak performance, when something starts happening, like you're dealing with something and you're not too you know, acquainted with it, you're like, what's going on, right? So you just shake your head and you keep on going. So you got to remember the mentality. It's the same thing in the athletes in the sports field, right? Because everybody wants to push, everybody wants to be part of the team. They don't want to let anybody down. We've talked about that in other panels. And the thing is that that's recognizing that. That's opening up the conversation of recognizing that. And it's true. And if you asked the question about me, it was exactly that. Something is different. Something is not new. And then you start connecting the dots, looking backwards, going, yeah, I jumped out of plane that many times and it's not fun when you land. And, you know, and then I got so many things dropped in my head, went to some blast over in Afghanistan, all these things that, you know, you didn't get major injuries, but you did get, you know, you're a big hit on the head, or you did get, you know, rattled. and you just kept on going. So is that affecting us now? That is the question, and that's where the science comes in these conversations that we're having.
Well, good thing we've got Dr. Tartaglia here, because that's a perfect setup for you. Dr. Tartaglia, is this driving with what you're hearing from military personnel that are coming and seeing you in the clinic?
Yeah, and I think, all three respondents, basically gave very insightful and I think very important, I guess, statements about what is going on. So, it's really important, as Paul mentioned, to realize that you're asking somebody who's had a brain injury if they're okay. Your judgment, your insight lives in your brain. So just like if your brain is hurt and you can't move your arm, or you can't concentrate, or you have some other problem, your judgment can be impaired. And so asking the person if they're okay is really maybe not in the best interest of the person, especially in that acute phase. And I think in athletes, people have realized that it's not okay to ask somebody if they're all right to play, that we need better markers. The other thing I think was really important is that, in the acute phase, people will focus on the physical injuries. And a lot of times the injury to the brain, they just feel like, well, the person didn't lose consciousness. It wasn't, a really, really big hit. So they must be okay. And look at them, they look fine. But thinking of these cumulative damages that can happen little by little. Yes, especially young people, we're very resilient, right? We have good compensation skills. That's the beauty of our brain. But how much your brain can withstand, you have to think about that. We have to think about brain health throughout our whole lives, right? We used to die in our 40s. Our lifespan is into our 80s. So throughout our lives, we have to think about our brain, and that every time you're getting even if it's a minor hit, over your lifetime, this could be cumulative. And I think the last point was really important also, is a concussion, a mild traumatic brain injury, happens on a landscape of a person. We're all very different. We have our own genetic makeup. Some of us are going to be more vulnerable to a concussion, to mild traumatic brain injury, to anything, right? Like some of us got COVID and some of us didn't. Some of us get cancer and some of us don't. And it has nothing to do with our lifestyles. It really is just, we're all made differently. And I think that needs to be considered, that, even though sometimes we look at people and say, well, they've been hit so often and they're fine, and that's okay, that's them. Some people get hit once and they can become debilitated by it. So I think, that's where I think the science really comes in. And it's great to hear you guys at this, early stage to think, from what I hear, and maybe obviously I have a biased approach, is I think it's really important for us to have ways of recognizing that something has happened to somebody, and to be able to say very early on, you know what, you need time to heal from this. It may not have been a major event, but to your brain it was. And you need to be given the appropriate time, the appropriate treatment to be able to recover from this insult.
Thank you, Dr. Tartaglia. And you talked about recognizing the symptoms in other. Can you maybe be a little bit more specific about some of those symptoms? And, for those active CAF members out there and for veterans, when they're looking and they're talking to their peers and they're interacting with their peers, what should they be looking for?
Yeah, and that's a great question, because it's very heterogeneous. So one of the issues that people have in thinking about persistent symptoms of concussion is, we've looked across our patients, and, our patients have concussions from different reasons, right? Could be a motor vehicle accident, sport, the military, a fall, other kinds of traumas. The number of symptoms people have after concussion can be up to 50 different symptoms, and include things like a headache. So post-traumatic headache happens in over 90% of people. Can be dizziness, can be vertigo, can be eye problems, can be concentration problems. Some people tell me they're emotionally labile. They cry at anything that day or for, you know, the next few weeks, or they feel completely blunted. Nothing phases them anymore. Some people, you know, their memory is very much impaired after a concussion. So, you know, some people get very anxious. Somebody, you know, Alannah was talking about post-traumatic stress disorder. Well, lots of people actually have post-traumatic stress disorder after their traumatic brain injury, and it's not addressed. And so those symptoms prevent the person from getting better because they actually are completely overlooked.
Thank you for that. And Bruno, you were talking before, you were talking about, you know, the team and taking care of your teammates. What are some of the things, you know, or maybe talk a bit about the mentality of, you know, soldiers and athletes a little bit more, of the fact that, you know, we're really willing to push through things ourselves, but yet when we look to others, you're much more sympathetic, right? And you're much more willing to take care of them. Do you have any instances where that's happened, or did somebody do that for you?
Yeah, always. You know, the thing is that when we're part of a team, you don't want to be that guy, right? You don't want to be the guy that keeps everybody back. You don't want to be the guy that's, you know, being a burden or kind of keeps the team back and all these things. But once again, we're taught from basic training to look after the other person, right? The guy to the right or the guy to the left of you, and making sure that we get the mission done and all these things. And it's the same thing for sports. I really like the fact that, you know, when I started meeting world-class athletes, that there was a correlation between soldiers and athletes in the way that they train. They basically decided to dedicate their lives to bringing their bodies, their emotion, their brains to the top level of peak performance to achieve an outcome as a team. And when I saw that, and the symptoms of leaving either the sports team or the military are very, very similar. And I think the conversation of going through the team is that we look out for each other, but there's also that thing, like we were talking at the beginning, when they were said, like, you know, like doctor said, it says, we don't ask that person if they're okay. You don't want to be overstepping your boundaries and say, hey, you know, there's that feeling of brotherhood and all these things that you want to say, hey man, I think that, hey, I'm fine, I'm good. You know, it's so this kind of dance that needs to happen until you really see. And we're really prone to react to really big injuries. We have zero problems with that. You know, you see a broken arm, or you see, you know, somebody with holes in them, and you're going to deal with that, no problem. I have no problems dealing with that, compared to somebody who's got an injury that you're not too sure about, that you're uncertain, that the signs aren't quite there. You don't want to overstep your boundaries and say, you know, I really like what the doc said, or it's not okay to ask someone if they're okay. But how do we recognize that? And we got to understand too, there's a thing about, you know, there's always the question, what could we do better for the Canadian Armed Forces, of opening up the conversation of that. But we still got to remember that we got a job to do. And it's a serious job, and it needs a certain type of training and a certain time. Like, it's the best conditioning you have in the world. Like, that's why I do so well when I go to corporation and train them, is that I take military training and conditioning to bring up to them to get the job done. So how do we keep on keeping that job getting done, but also having some pillars that we can find and say, hey, you know, we can recognize that. What are the signs, right? Doc pull out a whole bunch of signs. How is the average guy in the forces, you know, that is doing his job every day, can recognize that in the person next to them? And when is it time to say, hey, go to Alannah, say, hey, Doc, you know what? He really hit his head really hard, but he says he's fine. What do we do with that, right? At what point do we step in and say, I got to stop you here? Right. And we always, you know, say, go see the chain of command and all these things, but everybody's kind of like a little bit off balance here. What do I do? We're all soldiers. We're all guys who jump out of planes and blow stuff up and go and do these things, and we're pushing, and I'll be okay. So I think that's where these conversations that we're having and trying to find a solution that's going to bring up, because we do care. We do care. Like, that's what we do. That's why we're here on this panel. We want to push out the conversation out there to reach the guys and girls that are in their living room having a hard time right now, not knowing what they've been through because of all the injuries they're doing, until somebody tends their hands out and says, hey, listen, I've been through this. this might be the things. You might have post-traumatic stress, you might have a TBI, does this happen to you, and all these things. And then the light comes on and they go, yes, absolutely, especially people who serve more than 20 years and they're in all advanced age and they have this, you know, kind of old world mentality saying, I got to be tough. Like I still talk to these guys today and I say, oh no, Bruno, I don't want to put in a claim. I don't want to see a doctor. I don't want to talk about these things, because if they do, they lose the simple identity that they had all their life. I was this soldier. I was this guy. I'm here to take care of others, not me.
Yeah, it's Ryan Carey, who's our military advisor, tells me all the time, it's you can't put one of those little blue tents that you see in the NFL for concussion. You can't put those things on the battlefield. Alannah, I think that's a great question for you. In practical terms, you know, speaking for CAF members, what is the right strategy there? If somebody does notice in their teammates some of the symptoms that Dr. Tartaglia referenced, what's the right thing to do? And the second part of that question is, my understanding is that sometimes the relationship with a unit and their medic is such that there is that trust where they could go and have these conversations. And certainly, you know, much like the world of sports, I understand the challenge of not wanting, you know, as you're trying to progress up the ranks, of not wanting this in your medical history, right? For fear that it could negatively affect your career. So what is the right way for the CAF to handle this?
I've thought about this a long time, and especially for serving, I thought, just because in certain areas we have limited clinicians that are willing to live in certain places. So unfortunately, certain bases, I'll just say Petawawa, for instance, may not have the kind of facility for these combat soldiers to be able to go and you know, get that assessment that they need. What I would love to see is just, you know, we're starting to have the conversation. So the leadership needs to have the conversation, and the leadership needs to pass it on to all levels. So we can go from, you know, company size down to section size, down to detachment size. But ideally, who's ever in charge, you know, we all take the combat first aid course. Now we have what's called a mental health first aid course. And this is something that I would love to see all the units doing. It should be part of a DAG. It's something that I think for those that are still serving, it would greatly benefit. Just even understanding yourself or recognizing the person next to you, but having that information just, and then having that every 2 years or whatever. The more you take it, the more information is going to stick. But you might just find out that you're the one who's got the complications, and that you have just recognized that you probably need to reach out. So I think what we need to say is it's okay to not be okay, and it's okay to reach out, and I am not going to judge you. And I think that's the biggest thing. And this is not the end of your career. It's what's the incident? You know, how are we going to treat it, and what kind of timeline are we looking at? It's not like before, where PTSD became a career ending. It's not anymore, because they realized they were losing way too many people by doing that, and they lost way too much knowledge and experience. So that doesn't make sense either. And now you've got a whole bunch of veterans that have all these additional injuries on top of just the initial one. You add your moral, and, you know, how was it handled? You know, what are things like financially? Like, there's so many other things that can play in. And now you've got PTSD, but now you have all sorts of little bullet heads popping out from that as well. So I definitely think there has to be a narrative, there has to be more training. And I do think it's the responsibility of the leadership to ensure that their subordinate gets to the right, whichever part of the medical facility, and it needs to be documented.
Yeah, we saw a big shift in the sports culture when Sidney Crosby had his concussion. And I think people realize that it's way better to miss a week or two than it is to miss a year. And, you know, when I think everybody starts to get on the same page of that, you do see progress. Lieutenant Colonel Kernaghan, can you maybe comment on that? I know you've been trying to spearhead some efforts within the CAF to try and address that.
Yeah, I guess I'll start by saying that it is really informative for me to hear what Bruno and Alannah said, and of course I think they're definitely on the mark there. You know, like what Alannah was talking about with leadership engagement is so crucial And certainly, I agree with Bruno that if when we know that other people have injuries, that we really work hard to support each other. I guess just one of the things that I've noticed is that if we don't know that someone is injured, how people get treated. That, there's the signs and symptoms of the acute injury, and then there's the subsequent post-concussion syndrome or the longer term effects that come out. And, what I noticed in particular with concussions is changes in personality. And it can happen from any brain injury, but that change in personality with concussions, it seems oftentimes that people become very irritable and incoherent and almost irrational at times, and very angry. And it's the chain of command when they don't recognize that this is potentially from a brain injury or specifically a traumatic brain injury. They treat that as an administrative or disciplinary problem. And all of a sudden, the leadership in the organization that you expect to be there to support you turns on you and creates, and Alannah, kind of alluded to this, turns into it creating other injuries, moral injuries, sanctuary trauma, because you thought they were going to be there for you. You don't understand why they're not supporting you when you're injured, and they only see it as you've become a disciplinary problem for some reason. So it's that education for the leadership is so important. Now, more to your question about implementing stuff into the military, it seems like there's uptake. It seems like, at least from the lessons of PTSD, that the chain of command has learned, hey, you know what? It doesn't do us any good to ignore this problem. We need to get ahead of this and not be reactive. But the institution is not a fast-moving organization. So I think that there's a recognition, just like they're working on plans for mental resilience. There's a recognition they need to do something about it. And I'm confident with continued pressure it will change, but there's still a long ways to go yet as far as what you call, Tim, the knowledge transfer of MTBI and post-concussion syndrome.
So one of the big areas of success that we've had in sports, and I'll talk specifically about football, was the understanding that 75 to 80% of these injuries were happening in practice. You talk a little bit, Lieutenant Colonel Kernaghan, about training, and would there be some opportunities to reduce risk by taking some of the risk out of training?
Yeah, absolutely. So, there's this saying, and I'm sure the others on the panel here will nod when I say this, that you hear a lot saying, train as you fight, which doesn't, yeah, sure, we want to make things realistic. Yes, we're preparing, as Bruno said, for very important missions that have dire consequences if we don't get it right, and people need to be inoculated and prepared mentally for that. But just that moniker of always train as you fight, always expose yourself to all of the risks is really damaging. So in the case like we've talked about, Tim, where we're looking so closely at mild traumatic brain injury from blast exposure for things like doing breaching, why do you need to be right next to that charge every single time now? You don't need to be exposing yourself to these overpressures and blast waves like we thought that you did. Once you've done the initial training, like we talked about in football, once someone knows how to hit, do you need to be hitting every single practice like that? So it's important during initial training, but I would totally agree that most of the exposure, except for major blasts, major incidents that occur on operations, those smaller exposures are certainly most prevalent during training.
Yeah, it's like when I talk to coaches, it's, you don't want the first time a player is going to tackle to be in a game. But that being said, as you're creating practice schedules, just being aware that every single impact has a cost. And I think if people approach it that way, it really helped in the sports world and maybe something to look at with the military. But try and end on a positive note here, Dr. Tartaglia. Maybe discuss some of the rapid advances in treatment that have happened over the last couple of years.
Yeah, I think, in the recognition that, this invisible brain injury has consequences that are, in many ways, they're treatable symptoms, right? So let's start with headache. Post-traumatic headache is not that different from headache. And you may or may not know that headache is one of the most common afflictions on the planet. And we do actually have very good treatments for preventing headaches, because you could imagine a person who has a concussion who ends up with a daily constant headache that can go on for years is really not going to be at their best. They are often can't sleep well, they can't think well, they can't concentrate, they get irritable, they can't do their jobs properly. And we do have good treatments for that. Also, mood issues. So we now know that post-traumatic neuropsychiatric symptoms are very common. So anxiety, depression, super common. Well, we actually do have decent treatments for that. Some pharmacological, some non-pharmacological, often in combination. We actually can have really good success rates. But it's not uncommon for me to see patients who've had concussions a year ago and they're struggling with kind of obvious symptoms that would be recognized if you went to your doctor and said, oh, I feel like this, as depression or anxiety, just with no treatment at all. After concussion, people can sometimes have altered sleep and over time even develop sleep apnea. Well, sleep apnea is bad for everybody's brain. We have good treatments for that. Not the most sexy treatment, I have to say, but we do have good treatments for sleep apnea. And untreated sleep apnea is actually really bad for you. Somebody was talking about this irritability. Well, we have ways. Irritability is a sign of depression. So sometimes people, they're patients. The most patient person can become so impatient, and their personality is completely changed. And some of the symptoms we can actually deal with to try to get that person back towards their, let's say, baseline. And I think the most important thing is to make sure that the person is taken out of harm's way. We do not, promote inactivity. We do not promote rest, but we definitely promote that a person not suffer another concussion while their brain is still trying to heal from one. And so we promote physical activity, low impact. And there's actually a lot of research right now that that's really good for the brain. But we don't want them to do it in an activity that puts them at risk of suffering from another concussion. So I think that we have made a lot of strides in terms of understanding that some of the therapies we had for, let's say, the primary problem can be applied to patients who have a post-traumatic symptom, and that they need to be dealt with. Also, that they need to be dealt with early on. We don't want people to end up in these chronic states of depression or chronic pain or chronic concentration problems. We would like to intervene early on, and we know that from many different illnesses that that's important.
Thank you for that, Bruno. Before we go, you've been a real leader within the veteran community of promoting peer-to-peer mentorship. And we certainly as an organization support that and feel like that can be really important for veterans, that no longer have the structure of being within the CAF. Can you talk about the role of sleep, diet, and exercise, and if you've seen positive results in some of your peer-to-peer mentoring?
Yeah, absolutely. That obviously, what you just mentioned is the foundation of everything, right? If you eat right, you're going to feel better about yourself. You work out. That's one of the things actually. The working out part was when I was really struggling with post-traumatic stress as I was being released. I asked the question, what was I doing when I was at the top of my game on a consistent basis? And it was working out every day. We work out. First thing in the morning, we do PT, morning PT. And to me, that is still today a thing that needs to happen. It needs to be, it's an outlet. It makes you feel good. It's an achievement in your day. It's all of these little ticks in the box that starts happening. And then you add on nutrition with that. And, you know, now you're starting to feel better. Everything is working right and all these things. And the peer-to-peer, reaching out and talking to people who understand it, is really, really powerful. We're very used to, you know, and the doctor is here and all these things, to go see the doctor, and she tells us this is what, you know, you have, and you get the you know, the diagnosis, and this is what we're going to do, and this is the protocol, and this is what we're going to do. But when you talk to somebody who's been through it, who's just a few steps ahead of you, it's the way that we learn in the military. We follow the leader. So if the person is up front and they're doing it, I think that's the power of the peer-to-peer. And if we can just send out there the message that if you reach out, there's people without judgment, like Alannah said, without judgment, that's just going to take you on and say, hey, listen, this is what I'm doing that's working for me, right? One of the things when I talk to the veterans that are out there, or even the athletes, is that, you know, they say, Bruno, I've tried everything, right? I've tried everything. And you go, okay, so have you tried equestrian therapy? Have you tried fishing? Have you tried crafting? Have you tried all of these things? And they go, no, I've tried group therapy once and I didn't like it. So do you understand? But that's because their field of view, their arcs of fires are so small because they're in so much pain and their anxiety, and they don't know what's going on. But then when you have a peer-to-peer, hey, listen, I've tried this expedition to the North Pole. I've tried the Invictus game. I've tried Soldier On. I've tried all these things. So, you know, I'm very lucky because now of the work that I've done, I've got these bags of tricks that I can pull out and help out in that way. And that's just what it does. But now we need more torch bearers out there that can do that outside. And it's very, very important. The foundation is all there. So I always ask them, what are you eating? What are you watching and reading? What's your daily routine? Is basically some of the first questions that I ask, because it's going to tell me where they're at, right? And then the minute they start, you know, and then everybody thinks that going back into it because they've gained weight or they haven't ran or they want to go back to when they were at the unit. And it's not going to happen. It's not going to happen. I started back with 5-minute walks, and then it turned into, you know, 15 minutes walk, and then instead, you know, a little workout and a yoga and a meditation and all these things. And then it tacks on, and then you get back into shape. And now I'm in even better shape than when I was in the forces, because now it's a different type of workouts. It's a different type of wellness that I'm doing, which is balance of what I need, not just what's being offered as a blanket thing. We're going to do this type of PT. It's exactly what I found. It took me a few years to figure out what my daily routine would be and what works for me.
To close up here, Dr. Tartaglia, in January, we submitted a $46 million research proposal to the federal government, which is an eye-popping number. Can you talk a little bit about the research that you and your team are proposing, and what that will mean for active CAF members and veterans?
Yeah, I think, you know, our proposal is really about, you know, multiple, a multimodal approach to this, right? So the first step is really to recognize that a brain injury occurs, and how are we going to be able to detect it? And we need better measures there. We also need to understand what are the other factors that are at play. There's genetics, there's environmental factors. We're all different. We need to factor that in when somebody is getting this brain injury. And then, of course, the treatments, right? If you want to deliver personalized treatments, then you have to understand this problem really, really in depth. And so the proposals are really about, you know, deeply characterizing people who've had these injuries and trying to figure out what makes the ones who have persistent symptoms different from the others, and also how are we going to make them better. We now know in many illnesses that disease starts long before you see the obvious clinical sign, let's say the end result. So we have to be able to pick that up and intervene at that stage. You know, in the world of sports, people recognize this entity of chronic traumatic encephalopathy, which is a neurodegenerative process, okay? Well, we would like to know, well, when does that start and how can we stop it from ever progressing? I think, you know, the brain is kind of the final frontier right now, and we have a lot more to discover. And I think somebody has said, we've now recognized that even these, you know, what we used to think of as very mild brain injuries can have long lasting effects. You have to know that in July 2020, traumatic brain injury actually made it to the list of a modifiable risk factor for dementia. People had recognized this and talked about this. I mean, there's been some studies in veterans, but it hadn't made it to the official list, and now it's there. So this is an important factor that is a modifiable factor. We've all hit our heads. If you're a normal child, you have fallen and, you know, maybe suffered a concussion or two, even when you were young. But the point is to recognize when somebody has an injury, when they need to be treated for that injury, and how are we going to prevent them from developing long-lasting degenerative consequences of that injury. And I think that's what the proposal is really based on.
Alannah, I want to give you the last word. What gives you the most hope in hearing us talk about this and just thinking about addressing the issue of mild traumatic brain injuries?
So I've been out for 6 years now and in the advocacy world, and I would have to say that in the last 2 years, there's been more conversation about PTSD and TBIs. And so I'm very hopeful that now that this is becoming basically a common words that you hear now, every single working group that I come up, there's some form of mental health initiatives. The budget just came out recently, and they have some initiatives as well to increase accessibility for mental health. And so now if we could, you know, keep moving forward, get enough programs available, I just really think that knowledge is power, and the more we educate people, the more we can look after each other.
Alannah Gilmore, Bruno Guévremont, Paul Kernaghan, Dr. Tartaglia, thank you guys so much for your time. Thanks for being part of the first Project Enlist Canada virtual chat. Thank you again to our sponsor, Galvian. And we'll look forward to doing this again soon. Thanks, everybody.
Thank you.